Hi guys. Yes, if you saw the title of this story, this is going to be about my cerclage I had placed last month. This was back in October. I know it's November. Today is currently November 9th. Sorry it took so long for me to post about this. I know some people have been asking me about posting my story in the incompetent cervix group that I've been a part of for the past 2 years, and you ladies are absolutely wonderful. I'm sorry that it's taken so long for me to say anything. It's just the whole experience was very traumatic. I'll kind of get into why it was traumatic and what actually happened when I had my cerclage and the whole rundown. So yeah, I'm pregnant again. If you see my post from previous years, about a year and a half ago, I gave birth to my son, Kason. I did have to have a cerclage for him. I had an emergency cerclage for him at 19 weeks. They don't really think it's due to the fact that I have incompetent cervix. It's that I have preterm labor. Very bad. The irritable uterus. I have dynamic cervix, which means when I have contractions, my cervix opens and closes during contractions. I recently found that out this year, and just any little thing puts me into labor. I could literally go help move a chair or something like that, and I'm having contractions. It kind of works out for women when you actually want to go into labor. It's pretty easy. All my labors, I have 3 boys. This will be the 4th boy. Yes, a 4th boy. But all of my labors are fast, quick, easy. Never had any problems. I think the longest I've ever labored from start to finish was maybe 6 hours. And most recent one when I had Kason was probably, I don't even know, like an hour or so. He just slid right out. I've never pushed more than maybe 3 times with any baby. They just pop out. So I mean, it kind of goes in your favor when you're ready to have a baby, but you know, of course you want your baby to stay inside as long as possible. So it really doesn't work out when you're not trying to have a baby, which is pretty much until you're full term. So it's the downside to that. I always have to go in labor and delivery, get Procardia or whatever to stop my contractions. So that's the reason why I had an emergency cerclage with Kason, the last baby I just had. And I did post in the group and post some pictures from my success with that, and I thank God for the doctor that placed that cerclage. I believe that actually was the only thing that held my baby in. I made it to 36 weeks. That's as far as I've ever gotten with any of my pregnancies. I've made it to 35, 36 weeks with all my boys. I don't carry long, but that's long enough for me to bring them home and healthy. So I'm glad about that. Also, this is not anything or any kind of story to steer women away from getting their cerclage. Note that cerclages are necessary. A lot of people, they're the only reasons why their babies have survived. I'm 100% pro cerclage. I don't want to scare anyone with this. This is actually the first time that the doctors have said that something like this has happened. So, not saying not to get it. If you have to get it, get it. My issue was I went in, once again, this is my 4th pregnancy. I was about 14 weeks. Of course, they check your cervix, blah, 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 blah. Look at your history. Say, hey, Kim, we see that you had a cerclage with your last baby. As a precaution, we feel like you should go ahead and get one with this one. Didn't really ask any questions because I've read a lot of women say if you had one once, you'll have to get them every single pregnancy after. Not really sure if that was the truth or a lie or whatever it is. So I'm just going off of whatever my doctor is saying is the best thing for me to do. So, go into the maternal field specialist. They checked my cervix. They actually told me it was 2.3 was the length, or 2.8. If you're familiar with cervical lengths, you know what I'm talking about. So it was already pretty short. So I was already alarmed by that. So they said, yeah, we do want you to go see another specialist. He's more of a specialist than the maternal field specialist. So I went to another hospital, saw another specialist that actually specialized in doing cerclages for women with shorter cervix. Oddly enough, when I went to his office, before they place the cerclage, they want you to come in for an appointment. They measure your cervical length. He actually said it was 4 and some change. It was longer than what they stated before. So he did ask, he said, why are you here? Why are you getting a cerclage? And I said, I guess my OB wants it as a precaution because of the fact that I have preterm labor and I had to have an emergency one at 19 weeks with my last pregnancy. So he said, okay, if this is what your OB is asking for, I'll go ahead and place it. One thing that he did say that I kind of should have took to when he said it was, I see where the last stitch was, which was down here at the bottom, and it was pretty low. It was a McDonald's cerclage with my last pregnancy. He said, so what I'm going to do is I'm going to put it higher than what that previously OB put it as. So it'll be a lot higher than what they put it, because you'll have a better outcome. Maybe I'll, my pregnancy will last longer than 36 weeks, because it did shorten with their cerclage when I got it with my last baby. So I didn't think anything of it. I'm like, okay, he's the specialist, so he knows what he's talking about. So surgery day comes along the next week. I think I'm 14 or 15 weeks. They roll me back. They put me under general. He went ahead and he put my cerclage in. Go back to the post-op. You guys, soon as I opened my eyes, I was screaming. When I say I was in so much pain, it was like worse than contraction pain. I couldn't move, I was in pain. I couldn't bend, I was in pain. I'm like, oh my God. The pain was so unbearable. They were pumping me with fentanyl, Dilaudid, every kind of pain drug, pain medicine you can think of. It did not, when I say it didn't scratch the surface, it did not scratch the surface. I'm leaving drugged up, still at a pain level on a 10. Only reason why I did tell them it was the 4, because I had to, my son, it was time for him to get from school, and I had to get my other son from daycare. So I was just like, let me go home. Maybe let me give it a few days. Even though I kind of felt something wasn't right, I was like, let me give it a few days and see. Maybe the pain will subside. That was on a Tuesday when he placed his cerclage. Wednesday comes around, no difference, none. Wednesday night, I go ahead, I message my sister-in-law because she is she's a nurse. She has a BSN. I said, hey, something's not right. I'm still in a lot of pain. And then I'm noticing I bled from the time from post-op. I was bleeding up until the time I messaged my sister. This is now Wednesday night. I'm like, I'm starting to have a lot more blood. Like, I feel like I'm hemorrhaging or something. And then it's clots coming out with that. I said, I don't feel like this is normal. This is not how I felt with my last cerclage. I had no pain with my last cerclage. I said, I feel like something's wrong. She said, that doesn't sound normal. You need to go to the nearest hospital. So I went ahead and went into the nearest hospital. They did an ultrasound. Ultrasound did show that I was hemorrhaging. Matter of fact, I was hemorrhaging into my placenta. And they went ahead and admitted me. So they admitted me. I called my OB because this was like the hospital of horror. I don't even know why I went there. They kept getting my chart like mixed up with a 75-year-old woman named Vivian. So they kept coming in there and saying, "Hey, aren't you Vivian?" I'm like, "No." She said, "You don't look 75." I said, "No, I'm not." So that's a whole nother story, that whole thing with that hospital. I won't be giving birth there, but that was the one that was closest to me. So anywho, they called my OB and they said she's hemorrhaging. Her pain tolerance is at a 10. We feel like this needs to come out. I spoke with her. She said, I completely agree. So they went in and they went ahead, prepped me for a spinal, took me back to the OR. One of the reasons why I stated earlier, the whole experience was traumatic for me, because they told me the amount of blood I had, you guys. Everyone that came in said my pregnancy was terminating. So they're telling me my son is gone. I'm thinking I've lost my baby at this point. I'm crying. It's like everything was going on at once. I didn't know what was going on. I thought my son was gone, honestly. The doctor felt like he was going to be more comfortable removing the cerclage in the OR, because they did think that the pregnancy was terminating, just in case they had to do a DNC. So once he removed the cerclage, mind you, I was still awake because it was a spinal. He saw that my cervix was closed. So thank God for that. They took me back in the room. I'm not sure how far after, because of the pain meds, but at some point they did do the Doppler. It took them a while, but thank God they did find my baby. He's still in there. He's still thriving. They don't know how, but I'm still pregnant. I did go back for a follow-up with my OB, not the doctor that initially placed the cerclage, that next Tuesday, and they checked my cervical length, and it's still at a 4 and some change. Well, it was then, and they were just shocked that I was even still pregnant. No one knew what went wrong. As far as I know, that is the first. I've tried to find people on YouTube, anyone that has had a cerclage placed, then removed. 2 days later, I have not found one. Will be 19 weeks this Saturday. I go back to the doctor next week. Whether or not my cervix has shortened, and if I'll have to have another cerclage placed by my OB, because I'm not going back to the same doctor. Not that I feel like it was his fault. I feel like it was my fault, because one thing I do advise you guys to do is to do your research on who's putting your cerclage in, especially if it's a doctor that didn't do your last one. Kind of, get comfortable with them and do your research and know that, is this the best treatment plan for you? I think the doctor should have knew that since my placenta, it lies low, very low, to the point to where it was on my cervix. So with him wanting to put my cerclage so high, what I think he should have paid attention to was the fact that it was going to put a lot of pressure on my placenta, which caused me to hemorrhage in my placenta. That's something that I think was kind of like textbook, and he should have known, but hey, I can't go back and change the past, but that's where I feel like things went wrong with my cerclage and why they took it out. I don't have one as of today. If I have to have one next week, I'll update you guys and let you know. I think maybe I will be the first. If not, let me know, tag me, let me know if someone has ever had one put in twice in one pregnancy. But this is something that is very unheard of. I'm just thankful that my baby's still here and he's doing well. And, despite the circumstances, things could be a lot different. I'm just blessed that, you know, I still have my child. So if you guys have any questions, just let me know. I'll try to answer any questions you have in my comments. I'm not gonna say who the doctor was or anything like that. I am in Texas, but you know, I'm not gonna put that doctor out there because he's had a lot of success stories with a lot of women. Sometimes things just happen. It's a one-off for many patients. So, but let me know and subscribe to my channel. Bye.